Hi, good morning, everybody. Hi, I'm Andrew Lau, Lowsutea president. It's so good we can have a chance to talk with you again regarding, all the issues on pre-diabetic, 3 high, and also, how do you really manage your diabetes good, okay, in the sense that if you are make sure to prevent you from diabetic complication. And what's interesting because what happened is one of my patients is a 68 years old lady who has, basically had high blood sugar for a number of years. And the thing is, she's on all kind of diabetic medication. However, one of the things that she didn't think about was really her cholesterol. Her cholesterol is actually very high. It's about 4 something, And I suggested, hey, you have high blood sugar, if you have high cholesterol, the chances you have for your heart might be affected. Now, suddenly she said, why? I have no problem. I have no symptom. I have no, whatsoever. I'm just managing my diabetes. I think I did pretty well. So yes, I said, that's true. Usually you don't get symptoms until you really get hit, and then you'll be too late, okay? So I said, why don't you start looking at, finding a cardiologist to help you out to understand where you're at. Now, certainly she listened. So she said, okay, I'll go check. So after she mainly really checking by her family doctor and so forth, and now she went to a cardiologist, but found out her, coronary arteries is 80 plus already blocked. So now she has all kind of getting more cardiovascular drugs, monitor it, and so forth. So now her surviving chance is better. Plus, she doesn't get into heart attack as easy as before. Now she has also a product called digoxin, which in case it really can get her heart circulation good, the muscles, at least it will help her to vasodilate it, and that heart can get nutrient and blood, so it won't get heart attack and really hurt her heart muscles. But simple things like that, a lot of people don't think about, and eventually it will just happen, okay? So what we're trying to do is at least alert you what is the basic, really common heart disease that pre-diabetic diabetes people will get. And it's not really just old age. I have young folks also have the similar issue, and at least they know and they can able to, follow through, and that is so important, especially women. And I will show you today, man and woman and heart is somewhat different. So we'll talk about that today, okay? Hi， 各位朋友，我係 Andrew Lau 啊，盧書 President 你好。嗱，今日講座咧，其實有好特別嘅東西，因為有個 patient 咧就60幾歲嘅。咁但係咧，其實佢個血糖就高啦，咁啊即係控制到血糖嘅。但係個問題咧，佢 cholesterol 都好鬼高喎。咁所以變咗嚟講之後咧，我就話俾你，喂，你個 cholesterol 咁樣高，你有冇睇過心臟醫生㗎？佢冇啊。我依家就話 family doctor 睇我幾好啊，咁我冇乜症狀啊，冇問題啊咁但係啲輕咧，我又話如果咁講，你真係要睇下咯。咁睇咗之後咧，原來佢個心血管咧80% stuck 咗㗎啦。咁所以個醫生咧就要開始幫佢即係俾好多心臟藥俾佢啦。咁 in case 佢唔掂咧，就俾個 digoxin 俾佢，可能夠最多通到血俾到 muscle 啦。咁繼續落去咧，即係依家有人 follow 啊，可能就係遲啲要通波仔啦。但係最低限度咧，有啲藥俾到佢咧，係能夠即係唔好俾佢更差。咁可能即係當要通波仔嘅情況都係好高下嘅。咁但係最重要咧，呢個情況下咧，我係 alert 咗呢個人，俾咗少少嘅 information。咁佢已經告花即係要好一個好嘅東西俾到佢咧，佢已經能夠令到佢咧係幫助佢 prevent 佢嘅個 heart attack。咁呢個係好嘅，因為 heart attack 之後咧，你唔真係醫唔到咧，你死人㗎。所以變咗呢個係一個即係我哋都即係今日咧係特別做嘅講座咧，係幫助你了解多啲，咁你就可能夠咧可以俾你更加係好嘅即係正常生活，同埋咧降低你嘅 risk 個 health risk 啊。OK， what is really heart disease for women, especially you have some diabetes or pre-diabetic, eventually, if you're not controlling your 3 high good, you will probably potentially have that. So I empower you, giving you the knowledge so you understand what is really heart disease for women. Okay, so women and men are a little bit different. So today we'll talk about that. So we're going to introduce what are gender different, and also what risk factor you will have, what kind of signs and symptom prevention, your lifestyle choice, and how Lowsutea can help you. And then at that time, we'll ask a lot more questions, and that's today's agenda. Now, actually, really at the end of the day, if you learn that you can prevent this, all these can be not happen to you if you actually start taking action, understand what to do. Okay, that's what my objective is all about. 嗱，各位朋友，今日咧我就係介紹你咧點解咧，就一等你了解心臟病有咩差異咧，有咩風險咧？對你嚟講，佢症狀係點樣咧？你點預防咧？用咩生活習慣能夠令到你咧唔會有呢樣嘢咧？嗱，其實你要知道咗呢樣嘢咧，咁你就識好多預防噶咯。For example， 我生活習慣改變咗啊，食嘢改變咗啊，我有 exercise 啊，咁嗰啲東西全部有晒幫助，飲去糖茶啊，全部有晒幫助。咁今日你了解咗之後咧，咁你就知道點去 watch 點去睇呢個病啦。嗱，今日咧我就見到好多朋友咧，我唔係好識嘅，喺東南亞亦都有，美國又有，加拿大有。咁我今日咧要嘥少時間講緊咩嘅叫糖尿病先。Now today, because I saw a lot of names that I'm not familiar with, so I thought that would be good. We can able to at least catch up with some of my new friends here who never joined us before. That would be real good. So that way we can able to at least answer some of the questions and so forth. So that's what we're trying to do. And so today I want to catch them up. So I'm going to spend a couple minutes just talk about what is diabetes, and I make it in a 4 stage. How to get to diabetes to diabetic. Okay. Now everybody will go through 4 stages before they go to actual diabetes. The first stage is the LDL cholesterol goes up, and then you will damage the B cell, which is insulin that come out with the B cell. The B cell takes the sugar into the cells, and then if damaged, the B cell doesn't work, then more and more sugar go in the bloodstream. Then the problem will start because your blood become very thick. The cholesterol, adding sugar to the blood becomes thick. And then you very quickly move to stage 2. That is your problem of all diabetic. It starts forming plaques everywhere. Your heart, your lung, your brain, everywhere. So with that, when the plaques form, then your blood pressure is going to increase. Now, when your blood pressure increases, you don't do anything, you don't feel anything, most likely you don't feel anything. So very quickly, you eventually move to stage 3. Your blood sugar goes up, your cholesterol goes up, your blood pressure goes up. And all doctor will measure one thing. It's called the HbA1c. To look at where you at, the percentage of sugar attaching to your hemoglobin. If your hemoglobin is 5, if your A1c is 5.7 and lower, you're a normal person. If you're between 5.7 to 6.4, you are pre-diabetic. Now, sad part is pre-diabetic. You have no medication. It's all depend on you, how you can able to, change your lifestyle and able to, exercise, lower your weight, diet, and measure your blood sugar all the time. So you know where you're at, so you can able to maintain not to go over 6.4. Now, if you don't do anything, most likely 3 to 4 years, you will change to diabetic because you're 6.4 above, you're diabetic. You'll ever be diabetic because you can't convert back. All these plaques are being plugged in your vein is not going to come back either. It will always stay the same. So you only can control, not continue get more and more plaques, okay? So this is how diabetes forms, okay? It's very simple. Now, why will ask people to drink Lowsutea? The reason is because Lowsutea have 2 things. One is guava leaf, blocking the sugar into the vessels, and then so less sugar into the vessels. And then with that bitter melon, the second thing, which increase the insulin sensitivity, taking back the sugar into the cells. Excess sugar and cholesterol and salt will be dumped out on the urine. When salt come down, your blood pressure will come down. So 3 high will come down. Sugar, cholesterol, and blood pressure. So that is really important. If you have low 3 high, the chances for you to get serious other sickness will be very limited. Now, besides that, really our company don't want to just give you drinking Lowsutea. We have a program that give you diet, understand what diet control, how to do low-fat diet, how to do exercise, how to lower your weight BMI from 30 to 23. Every week we have a free webinar by a medical profession. Also daily blood tracking. How do you track the blood? We want to make sure you have a real program, continue to empower you, motivate you, bring your A1C from 10% above, even all the way down to 5.7. Now, I saw a lot of my patients go down to 6.0 to 5.7, kind of on that range, is keep floating there up and down. But with that, they lower many of the diabetic risks. So you can do it. It's up to you, make the choice. I have a lot of patients who are pre-diabetic, they convert back to 5.7 and lower, and they are continue to be healthy. So this is, again, you can do it. It's up to you. It's your choice. And you don't need to be a diabetic or pre-diabetic to drink Lowsutea. Even though your cholesterol goes up already, drink Lowsutea. So you never reach to the pre-diabetic range. Okay？ 嗱，各位同學，今日好多朋友咧，今日我都唔係好認識嘅，所以我希望咧用2-3分鐘嘅時間 catch up 你哋咧。係知道咩嘢叫做糖尿病。嗱，糖尿病有4個 stage 嘅，第一個 stage 就係你 LDL 膽固醇上升啦，咁就 damage 嗰啲 B cell 帶啲糖入個細胞裏邊嘅。咁當 B cell damage 咗，越整越多糖喺個血管裏邊咧，咁胰島素唔係嗰個膽固醇再加血糖加埋一齊，啲血會好結。當血好結嘅時候咧，你好快就 move 到你嘅 stage 2。stage 2嘅時候咧，就喺血管咧就開始有好多板塊啦，一路係咁塞啦。呢個就最大問題嘅糖尿病啦，全身係咁塞，咁塞咗之後咧就翻唔到轉頭啊，永遠都係咁塞嘅喎。咁你血壓就會上升啦。咁但係你糖繼續上升嘅時候咧，好快脆咧，你又變咗嘅前期患病。點知你前期患病咧？所有全世界醫生咧都係度呢樣嘢嘅，叫 HbA1c。HbA1c 咧就有幾個 percent 嘅糖黐住你嘅 hemoglobin， 你嘅紅血球。咁如果你黐個紅血球咧之後咧，如果你5.7以下咧，咁你係正常人啦。5.7、6.4咧，你就係前期患病。但係好可惜，前期冇嘢食嘅喎，你只係要 change lifestyle， 轉你生活習慣啦、食啦、exercise 啦，同埋重磅啦，同埋飲虛糖茶或者幫助你啦。咁邊樣嚟講咧？你係要將呢個血 A1C 咧要減由6.4減到或者5.7，或者最低係6.0以下嘅東西，咁你先能繼續健康嘅。如果唔係過6.4咧，唔好意思啦，你轉咗糖尿病咧就3至4年咧。如果你咩唔做咧，好多人就轉咗糖尿病，所以糖尿病呢個風險就更加大，全世界更加大。呢個 app 呢個仲緊要個，可以講咧係會 ruin 你嘅一世嘅健康嘅，所以好重視呢樣嘢能夠幫助你。咁點解要飲去糖茶咧？去糖茶好簡單，佢有兩個 ingredient， 第一個叫做 guava leaves， 第二個咧就叫 bitter melon。嗱 ，guava leaf 咧就係個番石榴咧就將 block 咗啲糖入去血管裏邊。苦瓜咧就幫啲糖唔係當increase 咗胰島素嘅敏感度，就帶翻啲糖入去細胞裏邊。但係嗰、個當你有多個糖嘅時候咧，佢喺尿嗰度就掉咗出嚟，膽固醇掉咗出嚟，同埋呢個鹽都掉埋出嚟。當鹽掉出嚟咧，血壓就會降低。咁其實呢個苦瓜就咁做嘅。咁同埋公司咧就唔係話淨係叫你飲去糖就咁簡單，我有呢個5個 program， 我諗全世界依家得我哋依間公司做呢個嘢啫。我而家有差唔多200個 lecture 嘅。咁如果你需要咧，問我哋，我係俾個 lecture 你慢慢睇都得。咁就係咧可以教你食啦、exercise 啦、weight control 啦，同埋 doctor webinar 啦，同埋我哋有個即係每日教你點度糖啊，咁有晒制度化俾你。咁你就你 A1C 10以上咧，可以調翻5.7嘅。我好多病人都做呢樣嘢，所以好鬼正。Okay, now we caught up with everybody, so now we talk about what is heart disease basically. 咩叫做心臟病咧 ？Okay, really heart disease is very simple. It's really as a cardiovascular disease, which is the heart big vessels, where increase basically the heart, the blood vessel that the most important, the coronary artery are plugged up, so you become a coronary artery disease. You can have heart failure. You have a heart valve. You have a valve that close and open allow the blood to go up different chamber. That is also damaged. So all that will consider a coronary artery disease. But majority of the case is really a narrowing of the blood vessels. You know, remember we talked about why diabetes is so big important, because you form all kind of plaques on the vessel. Imagine this is the plaque. So the issue is your heart vessel, all these plaques become formed. Then your blood have different go through. Eventually this is totally closed. Then the heart cannot get enough oxygen and energy, oxygen and blood. Then the heart vessel will die. And when they die, it was so fast, 20-30 minutes, they will die. And once it died, you know what? You stop, you basically dead. Okay, so that's why it's so important. You have to have enough blood flow to all your heart vessels. And that's why today, the lecture, I want to show you what that means in a heart cardiovascular disease. 嗱，各位朋友，心臟病咧就係其實一個血管嘅疾病嚟嘅。咁包括咧好多嘢咧係能夠 ，for example 啦，冠狀嘅動脈其實你呢啲咁嘅心臟裏邊咧有心臟衰竭啦，同埋咧仲有咧就好多時咧你見到好多呢個脂肪咧 plaques 咧，血塊咧係塞咗喺個大血管度。咁大血管收窄咗之後咧，嗰啲血就去唔到啦。如果呢兩個全部塞晒之後，咁後邊嗰啲肌肉咧就會死噶咯，因為佢去唔到血嗰度嘛。咁唔死嗰度咧，好快脆咧，你個 heart 就停啦。一停咗你就死人。咁所以咧，點解今日好重要咧？就知道原來咧，導致最 common 嘅心臟病就係你血管開始收窄，然後收窄之後咧就會開始你個啲血去唔到你心臟嘅後邊啲肌肉咧，咁你就已經係一個好嚴重嘅問題出現。咁你就如果真係去唔到個心嗰啲肌肉開始死壞啫，一唔泵血咧，咁你就死人㗎。咁所以變咗今日講座係幫助你好多，呢個好重要嘅。So you know, woman and man have somewhat different, no? So very important. You have to now today. I'm basically focused more on women because the sad part is a lot of times the women don't even know she have a heart condition. And basically worldwide is 1 in 3 deaths in women are caused by cardiovascular disease. That's a high number because many of these people are not detected. Now, cardiovascular disease causes more than breast cancer. Is 13 times more of cardiovascular disease death than breast cancer. Now, women breast cancer is also common, right? But we found that cardiovascular disease cost to death is even more, 13 times more. And 54% so are not aware they had that. And so that's why they cause bleeding death, because they don't know, so they don't treat, they don't take medication, they don't go see a cardiologist like my friend. Even the blood cholesterol is very high. She don't aware. They can't relate. So really, 8.9 million of people died in heart disease in 2019, and 207 million people of women diagnosed with CVD in 2019. This is worldwide data. So really, at the end of the day, it's a high number. But you know what? With this, even though it's a high number, you can be safe and you can do something about it, and you will not fall into this number. That's what I'm trying to do. Today, our education to help you to be awareness, to build awareness, you go get doctor to check you out. So that is the case. So if you listen to the webinar, you can able to understand it. You start doing something about it. Hey, I think I do my job to make you aware and empower you to do act. Okay, that's what we're trying to do. So hopefully you continue to do that. 嗱，各位朋友喺每3個女士之中有一個死亡咧，可能係心臟病嘅發現嘅。咁同埋仲有咧，呢個死亡率咧仲多過你係有乳房癌13倍啊，所以係好勁嘅。因為女士家好多係有乳房癌啦，但係好勁咧就係13倍係有呢個心臟病嘅。咁仲有咧。54% 多數女士咧都唔知道自己原來有心臟病，同埋2019年咧有8.9個 million 嘅人咧係死於心臟女士喎，同埋咧仲有咧係275個 million 全世界啦， 就有有個 cardiovascular 心臟病嘅診斷有心臟病。咁其實心臟病好高啊，275個 million 喎。OK， 咁其實 so what is the difference in gender difference in heart disease? In other words, men and women have somewhat different in their heart disease。嗱，各位朋友仲有好特別咧，原來我哋性別咧係對心臟病有啲唔同嘅，就算 diagnosis 同埋我講係個 symptom 啊都有唔同嘅。所以咧，你有咩心臟病發嘅時候咧，可能個男士同女士咧都有不同嘅出現。所以今日咧就講多啲女士有咩注重。So as you know, gender is really make a difference. So really, women and men, if they have heart disease attack, is somewhat exhibit a little different symptom. That's why today we'll make sure alert you so you understand what to look for. Now, let's talk about what cause most likely you have your heart disease. Now, one of the biggest thing is hypertension. That's why diabetes is so important, because many diabetic, what they have, hypertension, high blood pressure. So if your systolic pressure is higher in young man or young woman, then down the road, most likely, you will also potentially have heart disease. So hypertension is a common form for heart disease. So you got to watch, okay? Second is body weight. Now, if you are obese, for example, your coronary heart disease is 1.35 times more than women, but man is even higher, 1.42 times more. So man, when you're obese, is even higher. However, the stroke is the same thing, because if you had a fatal stroke, 1.3 times more in women and 1.5 times in men. So in other words, stroke, people die, man is higher than woman, okay? In the heart disease, they're also lower, but man is 1.4 times higher, okay? Or coronary heart disease. So body weight is actually a very important issue. So if you are really 30, BMI over 30, you have to watch. Now, the third one is cholesterol buildup. Now, really, as I mentioned earlier, remember the heart vessel, your auto plaque on the side, when the plaque up becomes so close, blood cannot pass through, you will, in the artery, the blood cannot get to the back of the muscle, the heart will die. Now, the major difference here is men usually have the coronary heart disease are the big artery, but the woman usually go with the smaller blood vessels. So even with the smaller blood vessels, the risk is extremely high, because when they plug small vessel, you have no room to go. You go heart attack faster. So really, cholesterol can be a big risk for women. So that's why I thought that when my patient saw me and I said, wow, hey, your cholesterol is high. Why don't you go find a cardiologist to check it out? Makes a hell of a lot of sense. And lucky she did. So really, men's are the big artery. Women's are the smaller artery. So there's a major difference here. Now, also, usually, men and women, the difference is the woman has smaller heart, because woman's a smaller person. The body usually has smaller heart because the build yourself is smaller. And then, because the smaller heart, they can be having less the smaller vessels also. So narrow the blood vessels are also higher. So at the end of the day, that is all related. If you are small frame of human being, of woman, your heart will be, although it's smaller, but also your vessels are also can be plugged up. Smaller vessel can plug up. So again, the risk can be there more than you put a big arteries and plaque on the big arteries, right? For men. Also, another risk factor is women have pregnancy, and during the pregnancy, they have high blood pressure called preeclampsia. Really, the blood pressure goes up very high. And usually these are people who are gestation diabetic. And then if they have this type of disease before during the pregnancy, had high blood pressure, and they're gestation diabetic, the chances for them to have heart disease is also high. So these are the few factors women need to look at, okay? So it is actually hypertension, body weight, cholesterol buildup. Also, although they're a smaller body, but again, you know, the risk factor, if they're gestation diabetic, that's the chances for them to get higher chance of heart attack, heart disease. 嗱，咁講翻啦，女士咧，可能第一樣嘢點解你會有高嘅機會係有呢個心臟病咧？咁其實常見咧就係你血壓會上升。嗱，男士女士都係嘅兩個。咁尤其是咧，當你血壓上升到一個地方嘅時候咧，咁個 chance 就越高嘅血壓咧，就越高嘅你個 risk for 你嘅 heart attack。OK， 咁啊第二個啦，磅重啦。嗱，雖然咧男性磅重咧1.4倍咧，你個 heart attack 高嘅，女性係低啲嘅1.35，但係唔好唔記得。就算呢樣嘢係男性係都係即係會高啲啦，但係其實仲有一樣嘢咧，就係中風都係一樣，女士係低啲嘅，但男性係高啲嘅。但係呢個 risk 都喺度啊，所以磅個體重咧係好緊要，要 control， 降低你由30以上嘅 BMI 跌翻23，咁你個 chance 就低咗好多呢個 heart attack。咁第三個咧，膽固醇高咧，呢個亦都係好重要嘅，好多人都唔知道。但係個問題咧，喺女士咧，因為個 heart 係細啲啊，咁你血管咧係細啲嘅，咁就更加容易塞啲嘅。男士嘅血管咧大喺個大動脈嚟嘅artery 啊、大動脈啊嗰啲塞咧，就即係個風險係低咗啲咁多，但係都係好大風險。所以膽固醇咧係一個重要嘅情況嘅。咁就係人本身係咁啦，你本身個 body build up 啦，女士係細啲啦，咁啊心梗係細啲啦，但係個血管亦都細。咁仲有一個風險咧就係咩咧？當你係懷孕嘅時候咧，你有糖尿病之後咧，你個 chance 係有膽固醇唔係嗰個血壓會一路上升嘅時候咧，將來你會有呢個心臟病咧係會高嘅。咁呢個係你嘅一個風險啦。Okay, so we talk about, you know, earlier we talk about, hey, you know, hypertension, body weight, cholesterol buildup, you know, your body size-wise and risk factor. So now let's talk about what symptom you get. Now, in the sense that heart attack, for women and men, the symptom somehow is slightly different, okay? For men, usually they have sharp chest, you know, the chest pain right here, tight in the chest, and also really sharp pain, you know, things like that. This is the typical sign for man heart attack. But for women, they feel chest just pressure, and also they feel nauseated, vomiting, they got sweating, pain in the neck to the jaw throat, and they might have even abdominal pain and back pain. Okay, these are the very common sign for women. Now, I can tell you, I have as you know, I used to work with in emergency as an ER nurse in USA. So that woman comes in, she complained with stomach pain. So really, at the end of the day, you know, the symptom are stomach and back pain, not necessarily pain as the typical man radiate up to the neck. Pain, sharp pain, it's not like that. So when we start getting EKGs, that's not really, oh, wow, this guy's got ready for heart attack. So the symptoms are somewhat different, okay? On top of that, many of the coronary artery for women, they have basically getting, because remember the heart is smaller and the, sorry, excuse me, and the blood vessels are smaller. So they will plug up and will, when it plug up, as easy to get you the heart attack. So really, they will have a spasm when you pump. I feel painful. Okay, so these are symptoms that women will have. Plus, the worst thing is there's some vessels actually rupture. And if there's rupture, oh, you really got to go to hospital real fast because the chances of you survive are not as good. Another one is Tokosubo cardiomyopathy. Now, this is a problem is when you suddenly become very angry, like, and that, there's something that a lot of people have that, and that really at the end of the day, the heart suddenly cannot pump really efficiently, not pump efficiently. So, matter of fact, many of this is called a broken heart syndrome. So these are the very health conditions that you gotta go emergency right away, not a doctor office. You have to go actually immediately to the hospital, to ER. And usually people will look at, is your heart is being enlarged. They will also take a echogram, cardiac echogram, or see what kind of treatment you have. So sometimes if your heart really not pumping sufficiently, they even give you a pacemaker. Things like that has to be specifically treated. So if you have problems as, like, for example, a real heart attack, it's not going to doctor office again. You gotta go to emergency because the chances of you to be able to be treated immediately is in the ER, not the doctor office. So call ambulance for that, okay? So keep that in mind。好特別咧，就係女士嘅心臟病發作嘅時候個痛咧，男士咧好多時好痛呢度食啊，或者好多時咧就有啲痛係上到頸度啊，由呢度 radiate 上去，男士有晒呢啲嘅。但係女士可能咧有其他嘅痛法，佢痛法咧好多時咧就痛咗就可能有腹部痛啦，又 feel 壓力呢度唔係 sharp pain 喎，即係壓力咁落去。咁第一有可能有屙嘔啊。同埋咧，亦都會出冷汗啊，有頸上痛啊，仲好特別咧，有喉嚨痛啊、腹部痛啊。嗱，好特別，好多人咧係有腹部痛，女士啊，腹部同背脊痛。因為我舊時喺ER做嘅時候咧，我係出過一啲 patient 咧，佢入嚟個症狀咧就唔係心臟病嘅症狀，即係 typical 嘅心病，好唔舒服嘅心啦。佢話肚痛啊，背脊痛啊。咁但係問咗幾次，同埋做埋 EKG 係好快就知道佢係心臟病。所以其實咧好重要咧，呢個咧就係多數女士咧心臟病嘅時候咧，可能有肚痛、背脊痛、喉嚨痛、下懷痛，即係好似佢覺得感冒或者肚屙、肚嘔，咁呢個咧係 typical 嘅女士即係心臟病有少少唔同，就佢痛咧係有心壓落去啦，壓落去就唔係 sharp pain 嗰隻 ，OK？ 咁記住呢樣嘢係要注意啦。咁就係健康狀況，如果佢有個心係有好多嘢塞咗嘅時候咧，咁佢動脈係泵唔到好嘅時候咧，咁佢即係開始有個佢開始已經有呢個心臟病啊。咁依家咧就要去，即係要開始去，唔係見醫生，即刻要去即係 emergency。尤其是好多咧係個動脈係塞咗，或者係開始破裂流血出嚟，哇！呢個就更加要快去醫院啦。咁仲有咧有個叫做Tokosubo心臟病嘅變異，就係佢個泵得唔好，尤其是係好多時咧就係好一啲情緒上好緊張、好壓力好大，好咁佢咧就佢個血個心嘅裏邊泵咧係泵得唔正常嘅，咁呢啲全部咧就要好快去醫院啦。咁醫治嚟講咧，就多數醫生咧就會睇下你檢驗咗之後咧，又可能做個 EKG 啊。要做個 scan 啊，咁睇下你個心係點樣。咁但係呢啲咧係要真係醫生幫你做噶啦。咁呢個咧就所以係好多時咧要去emergency 係好啱嘅，即係去急症室。Okay, so we talk about few items in a sense already. Your sign and symptom movements are a little different. More important, a lot of times it's not only chest pain, right up to the neck. There could be a stomach pain, back pain, jaw pain, throat pain. So all these are very different from man's exhibition. So you need to, once you have that, you have to actually go to hospital immediately. Is not to go to a doctor office or make a doctor appointment. Just take ambulance and go there. Okay, so very important. And so that way, the time will be very important. The reason is if you are able to get to the hospital earlier, so even your heart attack, your emergency doctors are helping you to make you able to survive, get your heart keep pumping, or give you the medication and so forth. Now, if that's the case, how am I going to prevent my heart disease? Well, very important is lifestyle change. So important is in your diet is so important. You have to have not saturated or trans fat, decrease the cholesterol, decrease the sodium. That will contribute mainly to your heart disease. So the diet, if you are taking all kind of fats, a lot of red meat, those are things that will eventually contribute your heart disease. You don't eat vegetable, you don't eat fish. I think that would be very sad, right? So really importantly, you have to eat a lot more diet rich of fruits, vegetable, whole grain, lean protein like chicken without the skin. Eat only the meat, the white meat, and then you have more fish rather than a lot of red meat like beef, steak. Then you can help you to reduce your cardiovascular risk, because that is basically lower your cholesterol, lower your plus you don't go to McDonald's all the time, so trans fat are limited, and you don't want to take a lot of salt. So that way, all that will help you lower your cardiovascular risk. Now, secondly, so diet we're talking about. Secondly, you talk about physical activities. If you don't exercise, your heart attack will be much higher. So physical activity is so important. You walk 10,000 steps a day. And that is really going to help you to strengthen your heart and also strengthen all your muscles. And the chance of a heart attack will be less. If you are not active, you get obese, overweight, your blood pressure goes up, your diabetes will get screwed up. Your blood pressure goes up, if you're diabetic, your more sugar goes up, you're going to, for sure, leading yourself, your heart disease risk. So really, at the end of the day, physical activity is so important. Now, if you're a smoker, for example, now this smoking is a major factor for heart disease, because smoke damage your vessels, your blood vessels, lower the HDL, not LDL now, lower HDL, which is the good cholesterol. And then you also increase your blood clotting risk. So smoking is tremendously bad for your heart. Plus, potentially, you also get other disease like lung cancer and so forth. So lifestyle change is very important as right control. Better diet, more physical activity, and stop smoking. So important. 嗱，各位同學頭先講咗咧，我哋有幾樣嘢啦，係咪？咁女士同男士咧嘅心臟病嘅有 sign symptom 都唔同嘅。咁但係好重要咧，咁我點去防禦咧？好重要，生活方式係一定要改變。點改變咧？第一食啦 ，OK， 要食啲係低脂肪嘅食物啦，唔可以俾膽固醇高啦。要食多菜蔬啦、水果啦、穀物啦、蛋啦、瘦肉啦，就唔係肥肉啦。咁呢全部咧幫助你降低你嘅風險嘅，唔好食咁多 steak 啦，即係紅肉啦嗰啲嚇。咁呢個好重要嘅。咁所以生活習慣食已經係第一個係幫助好多係降低你個 chance 有 heart attack 嘅。咁第二樣嘢啦，好重要就係咩啊？哇！原來磅重好重要。當你如果成日都唔喐嘅，我又唔去行嘅，每日都冇行過一萬步嘅，我只係行啲咁多日都睇電視嘅，咁你個chance個 heart attack 係高，因為你肥胖咧你有血壓高啦、糖尿啦，同埋增加晒全部你嘅心臟風險，你個 heart 都唔 stress 嘅，咁你亦都冇個 exercise 幫助你行一路走行，呢個行就係要做呢咁嘅 exercise 幫助你咩啊？幫助你嘅心臟咧。個 muscle 係 stronger 嘅，咁如果你係冇咗一樣咧，咁你個心臟嗰啲 muscle 即係 weak 咧，係幫助，亦都你咁肥咧，個心亦都係好大，你要泵晒啲血嘅時候咧，咁你嘅 chance 個心壞咧係好高嘅。咁第三個咧就係食煙，食煙咧原來好多人都唔知道，就會係損壞啲血管啦，同埋咧亦都降低咗高密度嘅膽固醇呢個 HDL 啦。 咁然後增加你咩改血塞血嘅風險啊。咁所以變咗嚟講咧，呢三樣嘢如果你改變咗，亦都好幫助你啊，係減低你心臟嘅風險噶。食、喐同埋你 stop smoking， 唔好吸煙啊。咁但係咧仲有啦，咁呢三樣係你我諗多數都做到啦，因為你可能夠食一定搞掂噶，你可以選擇嚟，因為自己。第二，你磅重，如果你做多 exercise， 你磅重一定降低嘅。咁如果你係食咗好嘅東西，磅重降低，咁其實最重要就係 smoking 就得啦。So we already talk about the three things: diet, exercise, and smoking. Decrease, don't smoke at all. But on the other hand, biologically, for women, also will still affect the heart disease. The problem you have is hormonal changes, especially people are really going to have them post-menopause, after menopause. Because with that, they are decline estrogen level. So with that change, that will definitely affect your heart, okay? Plus, many women will also have diabetic because of diabetes, they also have a high risk with heart disease due to the thickening of the artery, the atherosclerosis, the thickening of the artery. So the caused by really because of high blood sugar. The more sugar, the vessel become hardened, and then end result, you know what? Wow, you are basically marching yourself to heart disease. That's the reason why all along we ask you guys not to be a diabetes, because diabetes, 70% of the patients are having some kind of heart disease because the heart vessels become thickening and also hardened, okay? So also another change is ethical change. If you are basically African-American, Hispanic, or Native American, also women may also face the elevated risk. The reason is there's some genetic issue also there. So ethical changes also ethical the type of people, ethnic group will actually make you put into yourself in a higher risk category. Okay， 嗱，各位朋友，好重要咧就係因為咧好多時咧每一個人都唔同啦，尤其女士啦，咁女士咧收經後咧佢係喺個荷爾蒙係影響好多嘅，咁呢個荷爾蒙影響咧佢就冇咗呢個叫做 estrogen 嘅荷爾蒙啦。咁佢咧就低咗，唔係冇咗，低咗啦。咁佢呢個咧就會令到個心臟係個風險係高啲嘅。糖尿病係好常見，所以我係教育好多女士咧，一定要將佢糖尿病要有控制，因為糖尿病血糖上升好多嘅時候咧，因為成日血糖高咧，咁就令到你個血管硬化同埋塞。咁嘅心臟病嘅時候一塞咧，就你個風險就高好多啦。最後種族啦，即係如果你係譬如黑人啊，或者西班牙人啊，或者美洲嘅即係印度安娜嘅人咧，咁佢女士咧呢個可能性亦都風險高嘅。So also other risk factor. Now we talk about your diet, your exercise, stop smoking. Those are the things that can cause you potential heart attack. On top of that, we just mentioned earlier to you is your woman because your hormone changes, your diabetes, and your ethnic group is different, is also potentially change. Now, other risk factor is age. Now, when you get older, like 50 and above, and lady also that post-menopause, particularly you face a much higher risk, okay? If you have hypertension, that's the reason why drinking Lowsutea is so important. You lower your cholesterol, lower hypertension, lower your blood sugar, then you have better chance not to develop, besides pre-diabetic and diabetes, also heart disease. But if you have high blood pressure, elevated pressure, force the heart to work harder, bang, 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 then you increase the heart disease. Your heart become higher failure because you make a heart work so much harder. Now, the other risk is obesity. If you're overweight, you're 30 BMI above, This, especially the weight is on the tummy side, okay? So your risk of heart attack is much higher because more bigger your tummy, your weight is higher, that chances of getting heart attack is heart disease is much higher. Plus you have stress. Now you have chronic stress also contribute your heart disease, especially when you are stressed. You know what you do? You most likely eat a lot, like chips and over cookies, whatever you do. If you're stressed, most likely you also smoke and lack of physical activities. All these add together, you have also put yourself in a risk of heart disease. 嗱，其他嘅風險咧就係年齡啦。如果你50歲以上嘅女士，你收經後，你嘅風險一定高。第二樣嘢，血壓高。嗱，血壓高咧同心臟病咧係好有相連嘅，因為個心臟咧血壓高咧，個心咧係增加咗要好多力去泵個客啦，同埋個血壓成日好高啦。咁呢個咧係一個高風險嘅問題嚟嘅，對個客啦個心臟啊。咁肥胖亦都係喎，因為肥胖你過重過30 EN 啦，你個心係更加大，要泵啲血，咁就令到個心臟咧就 overwork 啊，咁裏邊嘅個心臟病個危險就一定喺度啦。仲有一個咧壓力，嗱，當你好多壓力嘅時候咧，就會影響自己心臟個心靈上嘅問題啦。咁你會食煙啦，或者食好多嘢啦 ，cookies 啊嗰啲咁嘢啦。咁如果糖尿病仲弊啦，因為你又 stress 加糖，個心臟導致心臟病係好高嘅。所以變咗嚟講，你一定要自己咧係要 take it easy， 唔好令到你自己咧係有呢啲咁嘅因為心臟病嘅風險就係因為你嘅 stress 嘅問題。所以其實咧繼續要休息 relax。OK， now we'll now talk about what you have in the sense of your diet, smoking, exercise, and your menstrual issues for women, and weight. And so what is a real actual symptom of the heart disease or heart attack? Now, classically, the woman only have some chest discomfort, and basically a lot of people don't have the typical man view of I'm so pain. It's a crushing syndrome, but they don't have that. They just have pressure. Okay, so really at the end of the day, when they talk about heart problem, heart disease, or heart attack, they usually just say my chest is feel not comfortable, rather than saying something real major heart pain is kicking in, very painful. They don't usually have that description. They say my chest feeling discomfort, some burning sensation, and feel full or pressure. And unfortunately, because of that, they don't have a real actual physical pain. A lot of times, this even can be missed. And so if you have really chest discomfort and feel full and pressure, you should actually talk to the doctor. Hey, can you check my heart because you're elderly, it's just not all the age, and you have diabetes. You need to talk to the doctor. I want to check, see whether I have a heart attack. Now, especially if you really have pain radiating up from the arm, usually left arm going up, and both arms to the jaw and back. Now that's even more classical. But above the two, meaning that only a pressure, and basically is feel sensitive fullness or some burning sensation, that is need to be not as typical, and you need to actually tell the doctor, can you check my heart? And also you have sometimes the jaw pain, and this jaw pain suddenly kind of come up, and usually on the left side coming up. And this jaw pain may be also a symptom. Now, lucky if you have this kind of pain, jaw pain, neck pain, sometimes back pain, upper abdominal pain, and also radiate to the back. Now, those are more obvious, which you need to really pay attention and hurry up and go to see the doctors. Not doctor, to emergency, really. The emergency, not doctor. If you have that symptom, you have to go emergency, call ambulance to help you to go there and check, because that might be really a sudden heart attack. If you don't get emergency take care of you, you might die. So you don't want to do that, right? So again, chest pain, any discomfort of what I just mentioned, go to see emergency doctors, not in the typical doctor clinic。嗱，如果胸口不舒服啦，好似 for example typical woman 咧，同男士唔同嘅。男士嘅心臟痛嘅時候就好痛啊咁，但係女士咧就唔係嘅。女士嘅痛咧係有個 pressure 咁痛，即係唔係同壓力咁痛。咁同埋咧有啲係唔係好即係typically 一啲人入嚟佢嘅描述佢嘅痛嘅想法咧就係、是。好似有啲壓力啫喎，好似好飽啊，同埋有熱即係有 burning sensation 感覺。咁就唔係講話個 sharp pain 好痛啊呢種劑嘅。咁同埋，但係如果你有啲放射性嘅上去痛法咧，去到下巴啊、頸部啦、背部或者腹部咧，咁呢啲就更加明顯啲嘅，係左邊上嚟嘅。咁牙嘅即係喺嗰個牙骹底下呢啲痛法咧，呢個亦都係。你唔知點解會咁咧？咁但係呢個係咁上嚟牙炸痛，咁呢個咧就真係咧係知道咧呢個係 most 呢個係 heart attack。所以好多時咧，如果你係冇咩嘅真正嘅症狀，好多醫生係 miss 咗嘅。咁你話俾醫生喂，你可唔可以同我 check 個心臟啊？我唔知係咪有 heart attack啊？咁所以變咗嚟講，因為佢如果有啲人咧，如果你睇唔到咧，佢可能 send 翻屋企嘅。咁你冇真正 check 過，或者俾啲俾啲Tylenol 啊或者呢啲咁嘅藥俾你咧，咁就弊啦。所以好多時咧，最好你話埋醫生，喂我可能有個心臟病嘅問題喎，咁咧我 check 啊咁所以變咧由呢方面咧就會係好啲嘅。Now, are the other obvious symptom is shortness of breath. If you have this kind of pain radiate upward to the jaw, and also now you have hard time breathing, your shortness of breath, and anything you do is really, besides chest discomfort, is really I cannot really do much, and I have hard time, like I have no oxygen. You will see, you will know. So your shortness of breath during activities, like when you swimming floor, like a shortness of breath. Now these are the sign and symptom, plus your pain coming up. You need to really pay attention because these are the typical heart attack coming. Okay, shortness of breath with all these radiation, all that, that's not good sign. Go to the hospital. Now, but on the hand, is a lesser, if you are lesser serious in the sense that because when I do my swimming floor at work, I shortness of breath. Now that might be an early sign, but you need to check it out. Don't ignore that. Now, also a lot of women experience difficult sleeping. They're insomnia, and they will not relate it to that issue. So you need to, if they cannot sleep, they feel always can't sleep, and they feel anxious, for example, and they felt that, wow, almost I'm going to die soon. These are the typical signs and typical comments of my patient who come in, tell me that, oh, I have a hard time sleeping. I feel like I'm just doomed soon. These are the typical symptoms of the with shortness of breath and also radiate of the jaw, this kind of thing. That is a very typical heart attack. So you gotta be really watch that. Okay, if you have this kind of problem, go to emergency. 嗱，各位同學，仲有好多 sign symptom 咧，你要注重咧，呢個真係可能係一個心臟病發作嘅情況。咁其實咧，你譬如我係掃緊地，咁我係好似透唔到氣咁。即係要透好多氣，我先喐得到。胸部又唔舒，即係個肺呢度即係呢度係好唔舒服。咁呢個咧其實咧就可能好快脆咧就有心臟病出現啦。咁所以你咧去醫院嘅。咁有陣時咧我瞓覺瞓唔到喎，成日都好似好焦慮啊，同埋諗住哇好似就嚟死咁咧。咁呢個亦都係一個好容易咧，好多女士話俾你聽，我係心臟病咧，係有呢個咁嘅講述呢個情況出現嘅。咁呢啲係全部你要快脆咧，真係去醫院睇emergency 啊。咁仲有咧 ，so other signs and symptoms which can be for women is kind of common. They feel nauseated, they're vomiting. Sometimes they got abdominal pain, and that is also good. That's the difference from woman and man is quite often in this one. So they will need to basically, when that happens, you got to tell the doctor, hey, is that possible my heart issue? alert them that they double check on your heart. And or if you also become extremely fatigued and become weak, very weak, and very weak that you cannot walk, basically, is how weak you are. And that's the time you also need to call the ambulance, go to doctors, to the emergency doctor. Now, also cold sweat is a now common symptom, often described as cold sweat. And the heart attack symptom of women, a lot of them have cold sweat and nauseated, and also short of breath with also fatigue. Or also they can feel very dizzy, lightheaded, and then the reason is because not enough blood go up to the brain, so they feel dizzy, and they will, matter of fact, many of them went to the bed and lie down and thought they could sleep it through. But when you have nauseated, extreme fatigue, cold sweat, feeling dizzy, it will not disappear. You can rest on a bed, but you got to call the ambulance, have you take the hospital, because that is more sign and symptom that eventually get you to real heart attack. So you got to make sure you do that. 嗱，好多女士咧，係會有嘔吐嘅感覺啦，極度嘅疲倦啦，就飆冷汗。當佢飆冷汗嘅時候咧，佢就個心其實咧呢啲都係啲症狀係 associated 嘅 heart attack 嘅。咁有陣時感覺頭暈咧，就係嗰啲血去唔到腦嗰度啊，咁你會頭暈。嗱，好多病人有個特別咧，就係我咁啦，咁我瞓喺張床嗰度啦，或者我好翻啲啦。嗱，呢樣嘢唔會好翻嘅。你瞓喺張床嗰度係可能夠休息到，但係你嘅心一樣繼續衰緊，所以變咗咧，你要快脆要叫十字車送去醫院，同埋話俾你屋企人聽，你話我真係好唔舒服，我有啲咁嘅症狀，你可唔可以同我幫手叫十字車啊？因為如果唔係咧，你可能真係喺個床嗰度死咗唔知 heart attack 啊。咁所以呢個好大嘅問題，所以一定要繼續即刻叫去醫院。Okay. So now we talk a lot about symptom. We talk about the cause of heart attack. Now, so how you prevent of this heart attack? Basically, so important is your lifestyle change. So how do you do lifestyle change? Very simple. One, you lost 10% of body weight. Now, only 5% is a good start, but it's really important to lose 10% of body weight. If you lose 10% of body weight, you also drive 1% down or A1C. So your A1C is 8, you will go down to 7. If 7, maybe go down to about 6. So it will make you healthy. Now, you have to eat healthy, meaning that you eat plenty of fruits, vegetable, whole grain, lean protein, healthy fat. You don't want to have saturated fat, trans fat, all those that take away no sodium, and you don't want to add all the sugar. Okay, so you take healthy diet, you make you healthier. And last but not least is regular exercise. Basically, you have 10,000 steps a day. At least 30 to 50, 1 hour will be moderate exercise. Just walking is good. And your weightlifting, light weight, they're good. Just do this. Using a barbell. Done. 1 hour every day. When you do that, you will be better. Okay? 嗱，點改生活習慣好簡單。第一，磅數要減低，最好減10% 你嘅磅。如果減數嘅時候咧，你糖尿 A1C 咧，你都可以減到1% 嘅。譬如你8要減7，所以咧減咗之後咧就降低你個心臟嘅風險，你個心唔會 overwork。OK。第二，健康嘅食品係要食緊咩咧？就水果、生果、穀物啊，唔可以食要健康嘅脂肪啊，唔好食嚿紅肉好大嚿啊。咁呢啲咧其實好重要嘅。咁當埋減低糖嘅食糖嘅東西 ，donut 啊，啲 cakes 啊 ，cream cake 啊，減低咗呢啲，咁你就身體食嘅一定好啲嘅。咁同埋有個規律嘅運動啦，每日要做大概30至45分鐘，1個鐘頭仲加好啦，一路慢慢升上去啦，行1萬步一日啦。咁當然啦，做咗呢嘢之後咧，你就一定會對你嘅心臟好有幫助。And I think that lifestyle change, you have to manage your manage your stress. Because chronic stress actually really leads you to heart attack. So in order to decrease your stress, you can do all kinds of things, listen to nice, soft music. yoga, deep breathing, meditation, mindfulness, all that can help you manage stress. So manage stress is extremely important because stress increases your blood pressure, heart rate, everything over heart. If you continue to do that, you get yourself a bad heart, basically. Okay. Now, certainly, it's very important. You have to continue to check up with the doctor, make sure that they know about your heart condition. Maybe end up they will give you medication for your heart. You also manage your blood pressure, cholesterol, and blood sugar. Regular monitor, and basically, you want to make sure all the cholesterol go down to about under 2 if you can, or under 90 for United States. If you can, blood sugar, you go down to under 6% of A1C, and your blood pressure got to be lower than 130 systolic, diastolic over under 90, okay, with 80 something. So these are the guidelines that you got to have. And it's okay to measure yourself every day. What's your blood pressure and your heart rate? All right, is buy one of these blood pressure cup. It's not expensive at all. Nowadays, the blood pressure cup as much as $20 US. You can get one in Hong Kong, $300. So very cheap. Buy one, do it every day, and record it. Write it down. Important, just don't just take it. You gotta write it down so you have a trend to understand. Wow, okay, my blood pressure is good, and I'm checking with me. My heart is good. So that way you can always look using simple thing. Check it every day, especially you're 50 and up. Do this, okay? Last but not least, really drink Lowsutea. Lowsutea has no caffeine. It's a tea that is not even a tea. This is actually a fruit. There's only guava leaf and bitter melon there. So it's safe to consume even during nighttime or even before sleep. And take it regularly. It will not affect if you're already taking blood pressure medication, cholesterol medication, blood sugar medication. It will not affect at all. Just drink Lowsutea. It will help you to lower your 3 high: blood sugar, cholesterol, and also your blood pressure. So 3 high will be lower. Now again, if you lower 3 high, the chance of heart attack is extremely lower your risk of being heart attack. 嗱，仲有唔係就係食咁簡單啦，唔係 exercise 咁簡單，你仲要控制你壓力啊。如果你壓力咧好多嘅時候咧，你個心就會壓落去，咁你心就可以壞喎。咁你變咗咧，你就亦都令到你咧 chance heart attack 高喎。咁仲有啦。你要常去醫生檢驗啦，檢驗你要膽固醇嘅檢驗啦，血壓嘅血糖嘅檢驗啊，血壓嘅檢驗啊，呢啲全部咧令到你睇住你個 trend 係咪有 improve。所以變咗嚟講，你有人檢驗咗你之後，好多嘢你知道咧，我係有咩情況下，我係可以繼續去呢種嘅生活係改變咗，令到我身體更加健康。咁當然啦，飲去糖茶好重要啦，因為高啊，去糖茶係冇咖啡因嘅，一係飲3杯。8杯茶或者隨時可以嘅，同埋仲有一樣嘢，飲去糖茶係幫助你降低你血糖啦、膽固醇啦同埋血壓，3高降低咗，你心臟病就亦都會容易降低嘅。So we know that we already told you that we shared it with you many times. We know that really Lowsutea help you give you healthy blood sugar, cholesterol, and blood pressure. With that, you limit your potential heart attack. 嗱，亦都講咗啦，去糖茶係幫助你降低血糖、膽固醇同埋血壓。呢個做咗之後咧，咁你就會能夠令到你咧降低咗3高啦，3高降低咗你嘅所謂嘅心臟病嘅風險。Okay, now we went a long way today. I think that you have a lot of good understanding about heart disease. The important thing is here, we empower you now with some knowledge, basic knowledge. So you can able to understand, wow, in women, what kind of heart disease that I should watch, and what kind of sign and symptom I should watch being a woman, because now you know the heart, what your heart might be end up doing, and what kind of most likely the cardiovascular vesicle has plugged up, then you get heart attack. So you got to recognize some of the different woman, different than man, but more important, you have to now know what sign and symptom look at. Really, that if you can understand that and able to, if that sign symptom occur, you quickly to go to the hospital, and rather than go to the doctor's office and wait there, and then he still got to take you to the hospital because he can't help you there. So if you have chest pain, it's a pressure, stomach pain, back pain, right up the neck, those are sign symptoms. Do not go to the doctor in the typical private clinic. Go to emergency because you are signing a heart attack. You need fast treatment there. The hospital can help you, not the doctor office. Okay. And also, you can do like a lifestyle change, meaning that your diet change, your exercise, your lower your weight, those will lead you to improve significantly of the heart health, so you don't get a heart attack. So you can able to learn more along the way. Listen to our lecture. Hopefully, we can support you along the way to help you to prevent your heart disease. You're not alone here. I told everybody, we are holding your hand throughout your diabetic journey, also holding a hand throughout your heart journey, so you can continue healthy and continue to be good health, so you can live long time and able to be healthy to help you to enjoy your grandchildren, and also you will not get sick, no heart disease. Man, I think I did my job, and you will be happy and I will be happy. That's what I'm trying to do. 各位同學，今日咧俾咗好多嘢你知道晒你嘅點解叫心臟病啦，女性男性有咩唔同啦。但係重要點咧就點能夠控制呢啲風險。如果你真係有個心有壓力啊 ，radius 上 neck 嗰度啊，同埋有 shortness of breath 啊，即係呢啲咁嘅症狀咧，就唔係去醫院，唔係去醫生啦，要去醫院。你要叫十字車要去醫院，因為你如果有心臟病發作嘅時候咧。你係一定要係醫院醫你嘅，唔係喺醫生嗰醫你。OK， 記住一樣嘢。咁記住咧，我哋係俾呢啲咁嘅知識你，等你有個 idea 知道咧。咁你咧知道咧就有事嘅時候就知道點去處理，唔會係就咁去錯咗地方，嘥咗你時間，亦都有可能咧因為咁嘅情況咧就你冇咗生命。哇，唔正仔！呢個我哋希望今日咧係俾到呢啲嘅。機會你了解呢啲咁嘅東西啦，咁你就可能夠繼續努力，繼續身體健康，繼續做你嘅生活改變，去做 exercise， 唔食煙，食翻多菜，唔好食咁多啲脂肪嘅嘢，咁你嘅心臟一定健康嘅。Okay, so thank you very much for listening to my webinar today. Now, sorry, I know many of you might have questions. Write to me, Andy, ANDY, at WAHFONG.com. So I hope I can answer some of those questions for you. Or you can WhatsApp us at 852-6792-8891. 852-6792-8891 or 852-3001-5644. So you can WhatsApp us. I can answer some of your questions. Okay. So I hope you enjoy your webinar today. I hope you get some knowledge of what is heart attack, heart disease. So that way you get able to, in case you do have that experience, you quickly go to go to emergency instead of just spend some time just to the doctor office, and that's gonna be able to help you to treat your heart attack. Okay. All right. Thank you very much. And if you have no question, I hope you guys have a very good day. Thank you again, and hope to see you every week. Take care. Bye-bye.